Canada's healthcare system doesn't just have a staffing crisis anymore. It also has a trust crisis. Well, understandable. According to a 2026 Environics report, 60% of the Canadians think that the healthcare system is declining or already in crisis. Only 5% said the system is excellent. So at this point, finding someone who thinks healthcare system is working perfectly is basically rarer than finding a family doctor itself. And honestly, people aren't just angry about the wait times anymore. It's a feeling of being passed around endlessly. You walk in clinics to ER to specialist to another wait list. You repeat your story 10 times and feel like nobody's actually responsible for connecting the dots. I can't even tell you how many times I've heard numerous patients say the exact same thing to me. It's almost like healthcare speed dating. But the important part that needs emphasis is that Canadians trust doctors and nurses massively, but they're losing trust in the system itself. So the people inside the machine are trusted, but the machine isn't. And every year we hear the same thing. More announcements, more promises, more investments. And even with all past healthcare investments and promises, somehow patients still cannot find primary care. And now AI is entering healthcare too. But only 27% of the Canadians trust AI tools for health information. And honestly, can you blame them? If people already feel ignored by the system, throwing a chatbot at them isn't exactly rebuilding trust. Maybe healthcare crisis isn't just about funding anymore. Maybe it's about the system designed for a Canada that doesn't exist anymore. More people, more burnout, more complexity, but we're trying to use the same old structure to solve novel problems with diverse needs. At this point, Canada stands out for having thousands of qualified Canadian doctors right here, internationally trained, ready and eager to practice, yet they remain sidelined by a complex system that requires radical updating and refinement to match the crisis that we face collectively as Canadians. These structural barriers, often compounded by inequities and limited residency opportunities without expansion of the spots that matches the actual needs, are becoming increasingly evident. Even as the country grapples with widespread doctor shortage and thousands of Canadians dying preventable deaths due to inadequacies and delays. We keep calling it free healthcare, but Canadians are still paying for it with time, stress, declining quality of life, and sometimes their life.